choice. Yeah. All right, it's 3 o'clock. I'll call the September Winnebago County Human Services Board to order. First order of business is public comments. Any public comment on anything on today's agenda item? Seeing none. Nothing on there. Nobody on except for Becky. Nice to see you.
Yep, I'm just joining you via Zoom today. Thank you.
All right, thank you. Yeah, nice seeing you. Yeah. Number 2, the health program.
That's going to introduce.
That's going to introduce.
I will introduce.
All right.
Y'all know me, but this is Sarah Brown, who is the HELP supervisor. HELP again stands for Homelessness, Eviction, and Loss Prevention Program. It's a temporary grant-funded program through the end of next year, December 31st, 2024. And the intent of the program isn't to work with people who are homeless, it's to prevent people from becoming homeless. So people who are at risk of eviction or foreclosure, things like that. There's sort of 4 parts of the program. One of them is to take a look at all the many different resources we have and coordinate them better, because there's a lot of different places that can help out with different things. So it's really to pull that together, and they've done a great job of looking at what's available to us, coordinating that, and helping all of our staff to be aware of that. The second thing is some people you can give a resource to and they will go ahead and apply or call or do what they need to, and it's all great. And other people need more assistance in that. So sometimes people need assistance actually filling out an application or going to a place. They just need a little bit more help than giving them a phone number. So they're able to help actually fill things out. An example might be if you're trying to rearrange someone's finances and look at food pantries and going somewhere else to like the Salvation Army for lunch, they can go to a food pantry or to the Salvation Army so that someone's familiar with it and how they use it and things like that. The third thing is really promoting this so that people are aware of it before they get to a point of foreclosure or eviction or non-renewal of rent. So by the time they're homeless or have a eviction, it's already way behind the 8 ball. So really promoting this, and that's really the phase that we're at right now, is doing some strong promotion of it. And then the last part of it is what we've learned through the ADRC, which is this is sort of modeled after, is that sometimes when you give a person a resource, if it doesn't work out for them, they'll just say, well, it didn't work out, they aren't the right place for me to help. They don't always call us back. So Sarah's program is doing follow-up appointments with the folks that she works with every 3 months, 6 months, and 12 months. We're not at the 12-month point yet, but she's doing follow-up to make sure that their housing remains stable. So that's the intent of the program, is to look at preventing homelessness, and I'm gonna let Sarah give you some information about it.
Okay. Would you describe or define loss prevention before you get too far into this?
Loss prevention would be it's not necessarily eviction, so it could be that they were given a non-renewal. So they're losing housing of some sort, or they are temporarily staying with someone, so they're losing the housing that they do have. Sometimes they're about to lose property because there's a gap in where they're at and where they're going, and they would lose all of their property if there wasn't some type of insistence. So it's different types of loss, often of housing, but not necessarily an eviction.
I wasn't sure about scamming or something like that. I didn't know.
Can I interrupt just before you start? I apologize to everybody, but for some reason our speaker's not working. Becky said she can hear us, but I have a message, so I'm just going to check the speaker real quick.
Go ahead.
And it'll might make a noise here. Okay, Becky, you can still hear us?
Okay, good.
Okay, sorry for the interruption there. Thanks, Sarah.
Okay, well, I can hand out, or we just take one and pass down. There's a flyer and brochure that has a lot of our information in it. So I just have some numbers and data. Some people like to know, like, who are we serving, how many are we serving, what are we doing, and then some ways that we've collaborated and who we're collaborating with, and then a couple of just stories to be able to explain kind of in real life what does this look like. So yeah, so since the middle of January last year, so in like the last 10 months or so, we've had 312 community members who've been enrolled in case management services. So someone that we've received a referral for from either human services themselves walking in and saying that they're having some sort of housing instability, or calling in. So we've had 312 that we've worked with. Of those, 69 were actively homeless when they came to us. So they didn't have a place that they were staying in. And so we kind of split those into two ways that we're looking at our numbers. So currently, as of today, we have 40 who are still actively enrolled with one of our case managers. So we have 3 full-time housing specialists, and then we have 1 full-time admin person who is really that first point of contact when someone comes into the office, or is the person who's answering the phone anytime anybody has a call that comes in. And so we have 40 people who we're actively working with. We've disenrolled 205 individuals already. And of those 205 that we've disenrolled, 159 of those, or 78% of those, their housing was stable when they disenrolled. So the other 42, when they were disenrolled, so about 22%, either the housing was unknown, or we unfortunately didn't keep contact with them. We've lost contact with them, or they just decided they didn't want or need any services moving forward. And so a part of that then, so that 69 that I initially talked about, so those are people who were actively homeless when they came to us. That's the number that we've struggled a little bit with. 46 continued to remain homeless per the HUD definition. So for someone who's buddied up with another person, they're not considered homeless per HUD. So we have kind of stayed within those parameters. So 46 of those 69 have remained homeless. So about 67%, where 21 who were disenrolled, we were able to get into stable housing. So stable housing either on their own and or stable housing with another person. And then 3, we only have 3 that we're continuing to work with who are still actively working with us. So though we aren't an outreach team going out looking for unsheltered people to shelter, if someone comes to us saying, you know, we're struggling with, you know, finding our own place, we're definitely willing and able to help out with that like navigation piece of trying to locate housing for someone. In terms of phone calls and walk-ins, so just like in the last month, we had 88 phone calls that have come in the 19 days, the business days that were open, 19 walk-ins, and of those 19, 10 people were enrolled in intensive case management intensive case management services. Like Beth said, some people just need the resources, they just need the direction of where to go. Some people want more of that support, you know, with those phone calls, with those applications, with some of the working with landlords and property managers. Looks like Mondays and Wednesdays are usually higher volume days, and that number, that 88, that has doubled. So we had been consistently getting anywhere from about 40 to 50 phone calls a day, 40 to 50 phone calls a month. And then starting in October, so when we really started to do more of that outreach and more of the advertising, that number has gone up to about almost 90 calls that we're receiving on a monthly basis. So that's been pretty cool to see. Some of the reasons that people call, the number 1 reason is rental assistance. Some sort of financial assistance is being requested, or they've received an eviction or a notice to vacate. So their housing is likely going to be becoming pretty unstable. An emergency shelter is needed. So somebody who currently doesn't have a place that they can go. And then the other one is really just in general housing resources needed, mostly specific around having a need for that lower income. And we have a lot of, what we've been mostly surprised with is a lot of our elderly population, really having a lot of housing insecurities there on a very strict income, usually anywhere from like $900 to $1,200 a month. And so really trying to find them subsidized housing that they would be able to stay and get into. And then in terms of just collaborations and partnerships, this has been really key for us, just because of the reasons that people are calling. We do a lot of work with Casa Esther and St. Vincent de Paul. they are able to help out in financial ways. So a lot of times they'll reach out to us and say, hey, we are able to contribute, St. Vincent de Paul is able to contribute, are you guys able to contribute in any way? So there's a lot of collaboration with bringing a lot of entities together to kind of help people with that rental and financial assistance. We're doing a lot of work right now with Advocap. Advocap is the one who's giving a lot of those vouchers. So they have the TBRA voucher that they're giving out, but their funding doesn't, they don't have the ability to be able to support someone with being able to find housing. And so that's something that a gap that we've been able to identify, and our team is able to kind of step in and help with some of that housing navigation piece for someone who has a voucher, which is really great. And then tiny homes also, with it being a transitional living space, we've talked about how it can help to be a part of transitioning people from tiny homes into their own space outside of more of that communal living. So a lot of good partnerships with Advocap. We table at the Oshkosh Area Food Pantry 2 to 3 times a month. So we're out in the community meeting with people who are there already receiving services, who might be or know somebody who is struggling with anything housing related. So they can come up, talk to us. We give out our information, and then they usually reach back out. And then we're doing a lot of work, and it's continued work around building relationships with property managers and landlords. One of the cooler things that we've seen is having landlords give our information to their tenants. So we've had a few, we're seeing more and more of that, where landlords are saying, here, reach out to them. We've had a couple people who, are only behind by $100 as opposed to being behind by $5,000-$6,000, where we've had people come in with $10,000 behind in rent, and there's not a lot of collaborating or anything that people can do. So again, the sooner we know about it, the sooner we're able to step in and help. And then just a couple of stories of how and what we've been able to do. We had a younger adult who came in looking for just help in general. She was very familiar with human services, was in and out of the foster care system as a child, and was needing more of that support in terms of her housing. We were able to help her apply to the housing authority, again, with a pretty minimal income. So we helped her apply to the housing authority. She unfortunately was denied at the housing authority, and so our team was able to help her with the appeals process there. It sounded like she had some disorderly conduct, but those were from when she was a youth. And so through the appeals process, they were able to go through and talk about all of that. And then she ended up getting housing, and then our team continues to be that support to her. So she'll reach out often if things are, she's just needing support with something, or she's just needing some direction with things, but she formed a really good relationship with that person. And so her and that case manager are still working together now. But again, some people don't know there's an appeals process and or even how to start that. So our team was able to help her navigate that. So she was able to get into housing. We had another situation where there was a person who was in a property that was infested with bed bugs. But there was also a bit of a hoarding situation going on. And so we were able to collaborate with Adult Protective Services, who was able to help bring in agencies to help with the hoarding so they could treat the bed bugs. The person was given a 14-day notice to vacate during that time. And if it wasn't settled, they were going to have to leave. They'd been at their place for 20 years. So having to walk away from that place, not a very good situation. So with us being able to collaborate with other people, we were able to sit down, have a meeting with APS, with the property manager, with the person, talk through a plan. They were very much involved with everything, really directed kind of the speed at which we were able to do things. We were able to get the hoarding under control, the bed bug situation completely taken care of, and then help ended up purchasing her a new bed. We'd found out in the process that she hadn't had a bed for the last 13 years because she thought if she didn't have a bed in her place that she wouldn't have bed bugs. Oh. So she was essentially trying to outsmart the bed bug situation. And so now she has a bed, the hoarding, you're able to walk through her place, and the bed bug situation is done. So again, we were able to kind of collaborate with a lot of people to get some of that stuff taken care of and keep her where she was currently living and not have to have her move to a completely different place after 20 years of being somewhere. So yeah, I can go on and on about stories, but Heather made sure to let me know that I need to keep it quick, so I won't. But those are just ways that we've been able to help out in the community with keeping people housed and prevent that homelessness direction.
Questions?
Bunch of questions. How do you find housing? Because I hear that the warming shelter is overrun with people and can't house everybody overnight.
Yeah, so I mean, the housing piece is more of a longer term piece. I mean, the housing we're not gonna find overnight. That's more of like, they're doing that together. We work pretty closely with the home consultants in child welfare who are also doing a lot of searching. So they put together what they call hot lists, so places that are available right now that we direct people to. If we hear of open places, we let people know. We also call, the team will call if there's signs up. So there's some of that housing navigation piece of things that this has really kind of evolved into as well. But I mean, we do a lot of the collaborating, I think.
And remember, this isn't to find housing for people, it's really to keep people in their housing, like the example she gave, or there was an older gentleman who his rent was going up, but he was on a fixed income, so it was even though it was a corporate people that were raising the rent, talking to the local manager and keeping his rent as is, so it's really not about finding, not that they don't, but they don't typically find other housing, it's that they're trying to keep people in whatever they have, yeah.
Okay, the UW Extension has a lot of services that seem to be real similar as far as financial support. And when I say that, how do I go about creating a budget? They've got food-wise, again, and so I'm just wondering if that is one of the places that you might be working with.
We refer to UW Extension for like Rent Smart and the programs you mentioned. We refer to Advocap, who's got programs that are similar to that. Forward Services. So there's other people who've got a distinct role in the community. It might be the Housing Authority. And so when appropriate, we kind of weed through which is the best resource for that person.
Okay, thank you. Pillars, do y'all work with them? Okay. And you talked about it. We had two words, one promotion, one advertising. It looks as though the way you go about advertising is going to the places that people that you work with would be going to.
Well, that and
So
school
St.
districts.
Vinny's.
Well, they're at the pantry regularly, but they also go like to the school districts and stuff. So part of that promoting isn't just looking for people who might have housing instability. Often a school social worker will know that a family's experiencing housing instability, things like that. But you can talk a little bit more about other partners, Salvation Army, other places.
Yeah, so, and we've all gone to the places where typically, yes, like our clientele would go. We've also sent like our flyers out to daycare centers. We send our flyers out to doctors' offices, the social workers at hospitals. Because again, yes, it's not just about like our homeless population, but it's also, I mean, our everyday people are having housing instability concerns or falling behind. And so it's really just how do we make sure the everyday person knows where they can go to be able to get the resources that they need.
Yeah, it's one of the areas that when I first moved to the community, I found very difficult to navigate. How do you find out about these places?
So Kate, just for your sake and for any of the board members, that housing is not a human services mission.
Okay.
It came about because Beth, as part of the submission by the administration for that $10 million grant from the Department of Administration for the
Neighborhood investment.
Neighborhood investment grant.
Yeah.
That we wanted to show a continuum from trying to prevent homelessness all the way through permanent housing. And so Beth created, in the space of that short period of time that we had to submit, she focused on trying to create a program, which we now call HELP, that tries to prevent homelessness from occurring, not to address all of homelessness in Winnebago County.
Okay.
So I just want to, and it's not a program that was intended to go on permanently. It was basically, part of the grant submission for the 2 years for the continuum. Our hope is that we'll show enough evidence that it's important, and that I would like to see a nonprofit in the community take this on as an ongoing project. But this, because it's not our mission, it isn't something that, you know, we were thinking we're gonna take this on indefinitely. So just, you know, to give you a bigger picture of this
Thank you.
is where did it come from? It was what we submitted at the time. Beth knew enough about homelessness because she was studying it on the side with, for a while. And then she said, let me write something for a prevention piece, which is what this is. So really, we're trying to get statistics and gather data and show that this is successful in whatever way it's successful. And then really my hope is next year that we convince a nonprofit that this is important enough that they might want to take it on as a role that they want to do going forward. That's what we're trying.
So that is then the county working with, or a community partner working with each other.
Well, to find out what this whole area is about first, and whether or not there's a role to be played for homelessness and homelessness eviction loss, right? And then I don't know that there's any particular nonprofit that's solely focused on this area, but there are a lot of agencies, for instance, AppleCap and other ones that basically deal with this in part, that maybe would see that they might want to expand their mission to include trying to prevent loss, as opposed to wait till people are actually homeless and then, you know, apply for financial assistance.
Okay.
Because what we're in short supply of is financial assistance to get anybody help to get into a new place. We're just trying to keep people, and I think that was a perfect example of, like, the person's in an apartment and they're about to lose their apartment, but there's some things that we can do and help with to get that stabilized so they can continue to live there. Otherwise, they would become homeless. So I think that's a little different area. I think that we're kind of exploring and using this 2 years to kind of explore that. So I just wanted you to know that our intention isn't to make this like a permanent.
Okay, thank you.
A part of our mission.
Thank you, I appreciate that. Because you've got a pretty broad mission.
We do. We could take on new missions, but it would have to be something the county board says they want us to take on. So for instance, alternatives to corrections and a prosecution through the DA's office, that was something a couple county boards ago said was important enough that they put a couple of positions in permanently to do that. So we have the Connect programs in the DA's office because the county said it wanted to do that. That was an additional mission for human services. But most of our missions are state driven. Yeah, just so you know.
Thank you.
Karen?
Thank you, Mr. Chairman. A couple things. You mentioned a child who come out of foster care. And I do often wonder what happens to those kiddos when they age out and they no longer have a foster mom and dad. Where do they live and how do they afford to find a place, and how do they qualify, possibly never having had anything in the past? So I don't know if you're doing anything with kids who've aged out. And the other thing is, what do you do about checking with, since Bill had mentioned nonprofits, churches that are providing meals and some churches that are doing rent assistance? Do you check with churches in the county?
We have a listing of, so you asked about housing, we have a listing of all housing that tells you where it is, who is eligible for it. So again, we don't find housing, we don't place people, anything like that. But if someone from the ADRC or vets or health program is looking for just, I need to get out of here and move somewhere else, we have a listing that we give people. Likewise, we have a listing of all the food pantries and food resources where you can get lunches, meals, you know, all different kinds of stuff that we give people. So that was one of the parts of Sarah's initial task, I guess, was to pull that stuff together. So we have that to give people. So we work with Salvation Army and AdvoCap and all these different nonprofits to see what they have, what the parishes and religious community has to offer. And we've got some handouts for people that we can share with them.
Okay.
And then about independent living, that does fall all on us. So there's, as the state, when kiddos are 14 years old, we start doing things for them and they're in care. That when they're out of their own home and they're in out of home care.
So you start training them at 14 to
We
be
start working
prepared,
with them.
prepared for that.
Yep, we gotta bolster that. We're working on that right now, make that better. And then when they age out, they're supposed to be moving to this independent living program that's developed, the state has created, outside of us. It's not great, so we continue to work on that to make that stronger. In terms of like potentially this youth, she may have been hooked up with those people and it wasn't a relationship that was worthwhile for her. So then she comes back here and finds people who are willing to help her, which is great, so that she's connected with their case manager. So that's something that happens with a lot of these kiddos is who are the people that are truly gonna help them? But we are tasked to help them as best that we can and as best that they want us to. Because once they turn 18, that's up to them. They don't have to keep coming back and some of them don't really want to
Okay,
work with us. But then they look at other options. That state option is one, going to those programs is another. Other people that we've hopefully helped them to connect.
okay, thank you.
Yep.
That's my questions.
You get them? Yes, Mr. Chairman. What my question would be is, we're going around this neighborhood grant and just talking about the day by day. They were part of that grant and got money for the homeless. And then after everything is done now, they have a different attitude about the homeless program. They're turning away people, a lot of people now, number one. And now they've changed it now that now they've gone to a 30, 60, 90 day, they can live there and stay there and not doing much homeless anymore. So now, I guess my question would be, you're in this area, there was a pretty good number of homeless at the beginning of all this. And now they're not taking them, but they're giving them housing for 30 and 60 and 90 days to stay there. Now, how does that affect you now? Is that something you would send them there for that housing? They could stay there free, or have you thought about that, or is that, and what about all the homeless people now that don't have the service anymore? And again, I know it's a private one, but it just seems like the grant was this way, and now after 2 years, they decided to change things. And you guys are part of the grant, so it's got to affect you, all this change there.
I think that's part of that doubling of the calls in the last month is that we're getting twice as many calls. We also do refer to them. So if it's a person that comes to us that's homeless, that's never applied with them, we refer to either the day by day, or there's a program called COTS. And then of course there's Father Cars. So there are several different programs that we can refer people who are actively homeless to. They may or may not get into any of those, but we do refer to them. And yes, I think the fact that they've changed their program is going to have an impact on their referrals.
Okay.
You have a question? Chris?
Sure. I would just like to applaud you for the work that you're doing and the program that you put together. Having worked with Rent Smart, landlord training, those agencies, you've put together a model that works for people, that you just don't give them a brochure and that reinforcement. And I think, Bill, I would love to see housing addressed this way by another agency. Harold and I do mediation for the county, him doing more than I do. Eviction is the #1 mediated issue. Winnebago County is one of the highest eviction rates in the state. This is incredibly important work, and the housing spectrum in Winnebago County is everything from a boarding house, which I had no idea existed when I started in this, and it's like scared me to death to think about, to just the numbers on the street. So thank you for putting it together in such a thoughtful way to approach not only the immediate need, but that follow-up is just critical, because it's amazing.
One of our earliest referrals was a woman who had some mental health concerns and was being evicted, and it was due to police contacts. And I'll give you a shortened version of this, but basically they contacted the law enforcement for that part and asked for any police contacts for that address, that person during that time frame, and the report was empty. There was no police contact. So they printed it out. She gave it to her landlord, and the landlord's like, "Oh, my bad, I had information." So she didn't end up being evicted. Had she been evicted, God only knows where she would have ended up. But they do a lot of advocacy and tenant rights, and so they've had to learn a lot. But they are really good at all of them.
Yeah, there's a lot of active partners and they're all good, but getting them to work together is quite an accomplishment. And so
They do well.
Becky, I see your hand up. Go ahead.
Yes, thank you. Do you by chance track from which part of the county these housing instability cases are coming from?
No, that we haven't been. It's something that we could start to look into. I mean, just off the top of my head, most of them are from Oshkosh. But we also see quite a bit in the Neenah area, Menasha area as well. But no, we haven't been tracking like the geographical location within the county.
We do have that data though.
Okay, can you help me understand that better? Because I'm hearing we're not tracking it, and I'm hearing we do have the
She
data. So
doesn't
help
have
me
it in the
understand.
Yeah, she doesn't have it in report. She's not running reports on it, but we
Okay.
have the raw data. We could run a report with the raw data that we have.
Okay, so you are keeping track of it. You know where the reports are coming from, or the
We have
calls, the calls.
Yeah, we have a client-based tracking system that all of us use in long-term support, and then also behavioral health uses it. And when we track track referrals to those programs, we can sort it by city that they came from. So
Okay.
if we wanted to do that, we could. It's in there. We just haven't pulled that data out of that database.
Okay, and then is there a help specialist available to folks in the northern part of the county as well, or only in Oshkosh?
We're all located in the Oshkosh building.
Okay.
We are able to get up. I mean, we go to Neenah. So anyone who lives up there who who is wanting to meet up there, we don't have anybody come down to Oshkosh who lives up in that area. We go to them and or go to their house or meet them somewhere in the community.
Okay, thank you.
The other thing is we do have an office in the Neenah building, and someone was there, but they weren't getting any walk-ins. They were getting calls, which didn't matter where they were, and that's why we don't have someone up there every day. They just go as needed.
Okay, thank you.
Yeah, Karen, go ahead.
Just a quick comment to Chris. I know I'm quoting stuff from 90 years ago.
Yeah.
But my mother grew up in a boarding house because she was a motherless child and her father needed someplace safe for her to live. So I don't know if you were scared about boarding houses. I don't know.
Well,
People have come out of this.
well, absolutely, Karen. I get, and I'm sorry if that's what it sounded like, but I had no idea the range of housing that was available in a community. And just as I've said this over and over again when I teach rent smart landlord training, there are good landlords and there are bad landlords and there are good tenants and bad tenants. And if we can just bring everybody to the middle, that, and because, yeah. But yet, right, I had no idea that you could find places in Oshkosh where you could rent a room and have a burner down the hall and the bathroom down the hall to live. It just never occurred to me.
I didn't know there was still boarding houses.
Yeah, it just was like, oh my gosh, the awareness in our community. And I did a book read with a group, Evicted a few years ago. And what I asked everybody that was in that book read to do is get in your car and drive around Oshkosh. If you haven't driven all around Oshkosh, you have no idea what the housing stock is in our community. And you can do it in every community. But creating that awareness, we know our neighborhood, right? We know our neighborhood and what people look like there, but just to, so the people they're helping are not the people that can just get in a car and figure everything out or have all those abilities. They need help. They need help. And it's so good to hear it's happening. And we've got a lot of really good landlords, as you probably know. And then there are some that at one point when we hired an extension educator and they were looking for a place to live, and I heard her say, well, what about this place? Somebody in the back room said, not them. Because the spectrum, it's that spectrum. And having 211 is a great resource, right? Right?
Yep.
But it gives you a name and an address and a telephone number. They're doing so much more than giving a name and address and a phone number.
Okay.
Yeah.
Any other questions?
If I may, please, I just want to make a statement. We moved up here from the south And what, that was about 35 years ago. And I'll tell you that the community has changed dramatically since then. But we came up here and we said, it's so parochial. If you live in Neenah, you don't leave Neenah. Go to Oshkosh, are you kidding me?
Pack a lunch.
Yeah, exactly. And so it's, I'm happy that we're getting more mobile. I don't want people necessarily to leave, but to know that I can drive down to Oshkosh now is really nice. Thank you.
Sure. Anything else? Thank you, Sarah.
Yeah.
Sure,
No problem.
Thanks for the handout.
Yes, yes. All right, moving on. Number 3, approve the minutes of the November 6th, 2023 Human Services Board meeting.
I'll move we approve the minutes of the November
Motion was made.
6th meeting.
Second.
There's a second. Any discussion? All those in favor say aye.
Aye.
All those opposed? Ayes have it. Number 4, accept minutes of the November 13th, 2023 ADRC and the August 15th, 2023 of the Specialized Transportation Council meeting.
I move to accept the minutes of the November ADRC meeting.
Motion was made to accept the minutes.
Second.
There's a second. Second was made.
I have a question.
Yeah.
I'm not sure we're looking at August, but the minutes for the specialized, say it was on August 9th. Our thing says August 15th. So who was,
I think that's my error.
are we looking at August and not October?
So was
Correct,
August
the
9th?
October minutes are not complete, these are from August,
Okay, which is it?
but it would be August 9th.
August 9th, not August 15th.
So change that on the
Right.
agenda.
Correct, that's my error.
Okay. That's my correction.
Motion was made to accept the amended August 9th date. Harold? Second?
I said it.
All right. All right, all those in favor say aye.
Aye.
All those opposed? Ayes have it. Okay, number 5, inpatient institutional placement stats. Bill?
Okay, so this is our usual graphs of our either very expensive placements or placements we have a lot of, so we keep track of these in particular for everybody. And this is kind of our weather vane of how we're doing. So page 1 is Child Welfare Division, Juvenile Corrections, and for a number of years, we had 0 placements there, and we are currently at 1 and continue at 1 for a while longer yet. 1 placement at Lincoln Hills costs us, and I don't know what the latest is. Do you remember that?
About 1,500 a day.
1,500 a day. So multiply that by 365 days, and we have what, 500,000 for a year? So we don't really want too many of those placements. It's when judges basically decide that a child has no other options and they've committed probably some pretty significant crime, and they just want the youth to be able to be at a different location for a year or so. And it's the equivalent of juvenile prison in Wisconsin. That's what Lincoln Hills is. There's at Lincoln Hills, there's also a separated area that's called Copper Lake, and that's for girls who get sent there. So it's in the same.
Are they the same price?
Same
Same price,
price and
yep.
same location. They're just separated by a razor wire fence, I think, between the two. So hopefully we can get our number 1 person back sometime next year. What's that?
Are they educated together?
I think they are. I
Yeah.
think there's a way to do some joint stuff, but where they live and reside are in 2
Day-to-day
separate
stuff is separate.
locations, yeah. Okay, so we're doing well there. So I don't see anything significant. Bottom of page 1 is Child Welfare Division Residential Care Centers. And I always like to use the example of Rawhide, because Rawhide is one of about 10 or 14 different residential care centers in the state of Wisconsin. And sometimes we end up placing kids at residential care centers, which is not locked and not barbed wire fence. They can leave there but they're usually there for a year or two at a time. And we currently have, as of October, 2.9 kids there. It's based on the daily averaged census. So again, you can see our numbers are up slightly from years past, but they're not significantly up overall, and we have to place them when we have to place them. So they're not quite as expensive. I don't think they're up to 1,500 a day yet,
Oh, but some of them are getting it.
but they're pushing 1,000 for sure a day. So again, a lot of our philosophy has been, let's really make the services in our community much more readily available, services around families, so that we can avoid page one.
Yeah.
And when I got here, I can tell you that page one looked a lot more like in the upper chart was probably in the 5 to 10 kids per month, and in the lower one about the same. So we've come down a long way from when I first got here. So I think our focus on community services has been a good change, and we serve a lot more kids that way too. Yeah.
And both of these are stable across, we pay it per year, but what positive things are doing to get them out of there? What, you know,
What are
Lincoln,
they doing?
Yours 15, but what are they doing to get them out of there?
They have goals, and they have things that they work on. In the case of the juvenile prison, it's more that they have to stay
It's time.
for a year or until they show significant improvement, which often doesn't occur. But it has. We have had some that have improved before a year. So RCCs are pretty much a year. And then that juvenile corrections is pretty much a year. RCCs, I think we try to shoot for 6 months and then see if we can, get them stabilized enough, get the family stabilized enough to have them return. So the goals are basically identifying what's up with the kid and how we can help them. And then identifying what's up with the family and how we can help them while the child is gone. And then hopefully get them reunited as quickly as possible. That's always the goal.
So you're doing all this while they're in there trying to help.
Yeah,
them
we're
so they
still
get back
working
to
with the
where they
families
were.
while they're doing their thing with the individual. And if we could get an RCC to actually work with the families, that would be even better, but oftentimes they don't have the staff.
Karen?
Mr. Chairman, a few years ago, the board was taking on a tour of the Oshkosh jail, and I saw a tray of what their food was. Do you know what the condition of the food is? In the schools, I think that young people, have certain nutritional needs, including milk and that sort of
They have
stuff.
that there. They have that there.
Yeah,
They have a meal for the prisoners here too, but it was pretty.
But you
sad.
have some different restrictions from adults and adolescents. Adolescents have to have more nutritious stuff than adults do.
Okay.
when it comes to kids, they're more aware of the nutritional needs, and they try to do more even organic vegetables. And I know in the case of Lincoln Hills that they have kind of a separate, it's called the Grow Academy, and they actually have kids working on growing things and then food prep.
Wow.
So they do pay attention to that.
Okay. Thank you.
Okay, page 2 is our behavioral health. That's BH, is behavioral health division. That's mental health and substance use. Oh, yes.
This juvenile corrections thing.
Yeah.
It's been going on for years.
Yep.
And it never gets resolved.
Nope. It hasn't been resolved yet. It's still there.
What's the whole of it?
Uh,
I mean, well, it's not.
the legislature.
I'd like to suggest that we get a couple of the people from Madison to come here and give a report. And the probably example, you start with Representative Shaw. He was always involved in this, but I think you should bring 2 or 3 people from Madison and give a report why this is in the words are gonna be, because nothing's being done.
Right.
And the cost keeps going up.
Right, and I mean, they're in a process, they were in a process of closing those 2 facilities down and opening up smaller regionals around. The problem is the money. The state won't put the money into it.
Yeah, but then
Build them.
is it the legislators that holding it up or is the governor? Why can't the governor get involved and try to make something happen?
It's a legislator to do it, and the one thing that we have to fear, and that's coming out of WCA or whatever, is the fear is the state's gonna come and create these regional places, but then they're gonna tell the county, you're taking it over.
Well, that's what the
But
initially,
we don't
that's
wanna
what they
do that. We
proposed.
don't wanna do it.
They were gonna have 5 throughout the whole state.
Right, but
That's what
they,
they started
but
out.
they haven't come up with the funding to build them, the building short.
Well,
I think,
You guys think it
Racine,
over, I think.
Racine and Milwaukee came close.
I'll talk to Representative Schrock and
'Cause
see
he's
if I
on
can
that
get him
committee.
to, talk to a couple other people so we can get him on a future.
Yeah, because Shaw's on that committee, the juvenile
Shaw
correctional
would, I
committee.
think Shaw would come. Or Shaw
Yeah, he
come.
would. Tell us what to do.
Talk
I
to
mean,
us.
it costs some taxpayers a lot of money when it keeps going up.
Yep, you're right. Okay, page 2, Behavioral Health Division. So this is, these are psychiatric hospitals that basically we send adults and kids to. And if they have no ability to pay, or in the case of adults, if they have Medicaid, Medicaid doesn't cover going into these hospitals. So by statute, we have to pay the full admission cost of them going to the hospital, and then we try to recoup money back from them. Usually it takes us decades to try to get the money back, and oftentimes we don't get it. But we still have to do it. It's a requirement of the state. The state pays us a little bit, not nowhere near what we need to reimburse us, but
Right, and these places are between 15 and 1,800.
this is, about
day.
15,
Winnebago is about low $1,500 a day, yeah.
yeah, 1,500 bucks.
A
Yeah.
day.
Yep, a day. But these are shorter stays, so generally speaking, we can get
These are
people
for a
out
year.
within a couple of weeks, although there have been outliers that have stayed for several months. So as you can see, take a look at this year and the up and down of the, I'll call it the cardiac rhythm here. Sometimes it's low and sometimes it's high, and we really have not been able to. If we would match every year after year, and we'd show you this whole list, because the other years are just averages of the year. But if we'd show you the other years, they look they won't look the same in terms of, we can't track it by month, but each of those years would have ups and downs in terms of months. And there's no rhyme, no reason to it. It's just people have, the other thing is people have psychiatric emergencies, but some people are employed, some people have other insurances that do cover, and then we don't have to pay for that. So we don't track that because it's not a requirement of ours to worry about that. So we're just tracking the ones that do go into the hospital that we end up having to pay for. And so what our goal is to, when you look over on the years going by here, is try to keep that number of average as low as possible. So if you look at our average, which is one of these straight lines here, can't tell if it's green or red anymore. My site is bad.
Yeah, that's good. Yeah, I can't see it.
But one of these lines will end up being our average for the year. And if you look at the last 2 years, it's probably going to end up being fairly close to the average of the last 2 years, which in my mind tells me we're not doing better, we're not doing worse, we're doing about the same. And we have only the people that we have right now to try to address this crisis situation. And we're not winning the battle, but we're not losing it either. We're kind of holding
But
our.
the thing is with these people here, these people that are on this chart are basically, this is their last resort. A lot of times they'll go to St. or some of the other facilities, but if they're full, they can't accept any residents at that time, then they go to Winnebago. So these are kind of the last resort people that don't have no place else to go.
Now, there is a good news piece of legislation that I wanted to mention to everyone. And that is that currently being introduced in the legislature by the Hospital Association, interestingly enough, and supported by the counties, is to request a waiver of the federal government so that Medicaid for adults could be used to pay for these admissions for up to 30 days. And if that passes, and we do get that exemption, then Medicaid will again be able to cover for these, and we will then see a reduction in the amount of people that are going to be on our dime. So we're advocating,
hopefully
we're all advocating for that.
That'd be great.
that'd be great, yeah.
Now, whether it'll pass this session or not, I don't know. Okay, so that was the adults on top, the kids are on the bottom. And the kids are much less by volume. I can't even read that points, what percent? What is that?
0.3, I think.
0.3 there. So yeah, 0.3 of a person per month, which means we had one child in for less than a month. And, or we've had maybe multiple kids, but less than a month. 9 days, a third of, no, 3, yeah, a third of one person is
Maybe a week, and a half.
Not
So you
that
said to get your money back, you go back for judgments or achievements? How do you get
Yeah,
your money back?
so over the years, we're allowed to do tax intercept, garnishment, stuff like that through collection agencies. If a person pays on their bill, so if they are making a good faith effort to pay, we do not take them to collections.
That can be for a long time.
It could be for the rest of their life. Yeah, but we let them pay because that's, we need to
Even
do
if
that.
it's $1, we'll take it.
That's not an area that you write off after a period of time. You're not gonna get it anywhere.
They have 3 months of non-payment,
Only if they have non-payment.
Okay,
and we notify them consistently during those 90
that's a lot of
days.
work. You guys are like that.
Got a spreadsheet.
She handles it. So you can see over the years, the up and down has gone up and down a little bit, but look at the number overall, though. It's still been on average less than 2 people per month. So it's not breaking our bank. Also, with kids, Medicaid will cover 60% of the cost. We only have to cover 40%. So the 40% is what Medicaid makes the states typically end up paying. But in the state of Wisconsin, the states make the counties pay because we're creatures of the state. All right, so page 3. Now we go to CW, which is Child Welfare Division, and it's secure detention, and we're talking about primarily Fond du Lac, who has a juvenile jail. And we contract for 4 contract for 4 beds. And you can see our utilization over the course of the year has been less than that. And we had a discussion about that last month where we have to do either 4 beds or no beds because we can't go lower. But overall, you got to remember, this is an average of a month. So we could have had 4 kids or 7 in their jail beds, but averaged to be 3 or 2.5. So we are getting value. We are getting the value out of it.
Getting value, and just to let people know, because I did look into it after the last meeting, we pay 125, which is what we've paid for the last 5 years, and we're paying that for next year. They're maintaining.
Yeah, 125 a day.
And where every other facility is $250 or more. So we not only have these 4 beds, but really only paying for 2.
Good deal, yeah.
So
That's a deal, yeah.
it's a great, huge deal. They probably will go up in a year, but we're gonna.
Yeah, like everything, it's gonna go up.
Appreciate it while we can.
So Fond du Lac has been a good partner, so let's put it that way. And the reason we do Fond du Lac is because Oshkosh does not have a juvenile jail. And it chose not to do that, and
And how is that different from Lincoln Hills?
Yeah.
How is that different?
a juvenile jail is 30 days or less. So
Oh.
they're awaiting a court hearing, or they're in there for a brief kind of, you want to call it targeted punishment. I hate to use the word punishment, but targeted.
Community safety, they would be there, we
Community
need
safety,
to maintain community safety while we look for another alternative placement for them, or
Okay.
help them to return.
So it's very short term, and that's the
Okay.
difference, and we can't keep them there for a long time. It's not meant to be the long-term decision of a case. Okay, down and below is the foster care numbers, and you can see those have gone down steadily over the last 5-6 years, and we're hovering right at around the 40 foster kids in foster placements. But if you turn the page real quick to the last page, you'll see our kinship care. So basically, where foster care has gone down over the last 5-6 years, our kinship care, well, that also went down too, according to the thing I'm looking at. But really, kinship care is where we really would like to see kids be able to go. If they need to be placed out of the home, we'd like them to be with their kin, as opposed to foster care providers. Now, kin can become foster care providers. And they're offered the opportunity to become a foster care provider if they want, but they don't have to. So as you can see, our kinship care numbers are much higher. And we think that's better, that we would have kids be placed with like kin when they're, having to leave their home for a while. Yeah.
I brought this up before. Is there anything that we can do to make kinship care reimbursement closer to foster care? And I will say, I brought this up here before, and at the last legislative meeting, we didn't have a quorum, so we could talk sort of freely. I did say that to Shaw, Growth, and Palmieri about it, trying to encourage some greater amounts of reimbursement for kinship closer to what foster care is getting.
Did they put in an increase?
But they put increase.
Yeah, it passed that, they changed the definition of what, like kin and kinship is and expanded that so that we can place them with more kiddos, and they also increased the rate. It is not yet as high as
Right.
foster care, but it's a
Higher.
significant. increase.
Okay,
Yeah,
maybe,
so they bumped it.
maybe complaining to Shaw and Growth and Palmieri made a difference, I don't know.
No, I think they passed, and they'll be seeing that starting next year.
Okay,
Okay, so that's our placement, and I would say overall, if you ask me how we're doing, I would say this is a pretty good report. Nothing is skyrocketing sort of out of control, which is good. And I will say, as a compliment to Annette and her staff, we got a report about 4 or 5 months ago that it looked like RCC placements were going to be in the 5, 6 range, and through October they've stayed. What was the number? Down to first page. October's numbers were 2.9. Yeah, 2.9. So all of our worries earlier in the year about having 5 or 6 did not materialize. And that isn't just because it didn't happen. It's because Annette and her staff were able to find alternatives where we didn't have to go to the need for RCC. And this is the thing, this is the reason that we do this, is because it's showing you that the work of human services is to basically not have these things get out of control, and because these are the placements that we want to try to avoid. We want to try to keep kids with their family and services wrapped around them. So if these numbers stay in line, it means that we are keeping kids with their families, even though the numbers go up.
That's good job.
Can you use that term yet?
The staff do work hard.
Yeah.
They also, it's not
Way to
also,
go.
it's not against them when they do have to go. So, sometimes it's luck. Yes, sometimes it is, yeah.
Any questions on placement?
Thank you.
Seeing none? Janet, financial report.
Okay, so you have the financials based on October. And you can see bottom line, it looks like we're down to about a $2.5 million surplus, so it's steadily coming down. And I expect that the next couple years, you're gonna see that start to come down even further. As far as our expenses, we're very close to what we would expect to see for a normal month based on the budget. Revenue, we have these ups and downs that we talked about last month when the state releases funds, so we'll see another probably large amount coming in for December, like we usually do every year. As far as where the surplus is coming from, again, it's mostly from unanticipated revenue and savings in our operations. On the third page, the labor bars, you can see that the orange projected is starting to outpace the budget. So again, we'll be needing a budget transfer once we close the books and see where we actually end up, then we'll make those adjustments. And the finance department will take the lead on that. A couple of things that kind of jumped out with line items. The emergency rent assistance and community program expenses and child welfare are going to be over budget for this year. When I took a look at rent, I kind of looked at last year's rent assistance versus this year's rent assistance. The number of people we're helping out has not changed significantly, but the rent amount has gone up about 7% this year. So I think it's just, the sign of the times and inflation and all of that. So we kind of keep an eye on that and see where that keeps going, but we do track that on a monthly basis. And And as far as consumer program expenses, there's some other things being done to try to keep families together. So staff is creative, and we just talked about the work that child welfare does. So some of those expenses have gone up. However, there's offsets in other line items, so we won't need to do any adjusting for those. In the behavioral health budget, the community-based residential facilities, CBRFs, we're expected to be only about half of what the budgeted amount is. And for that, we're continuing to see that places are having real difficulty in staffing. So we can't place people there because they're just not able to accept given their staffing difficulties. So sometimes that will lead us to place them in more expensive facilities, or other options that behavioral health staff will identify for the clients. And then finally, we had no prior year funds booked for the month of, which is October instead of September. So that's that one. So that's really it for this month. Nothing too unusual.
So one additional thing I just want to add, for those of you looking at the financial reports, if you look at the first page and the top categories, it's the white with the black numbers. It says labor, travel, and capital and operating. So those four: labor, travel, capital, and operating.
Yeah.
Those four areas, even if there are surpluses in 3 of the 4, which there are, which means that we overall will have a surplus for the overall budget. Whichever area is under budget or in a deficit, we have to transfer. There has to be some transfer of monies into that to make that even. So that's what she was referring to, going back at some point at the end of the year. We're assuming that that transaction is going to happen sort of county-wide, because one of the reasons that we're over in labor is because of all of the labor changes that we did this year. And instead of admin basically putting, so I'm talking about Mike Collard and the admin division, instead of transferring that money in during the year, they didn't do that. And so I think they're waiting at the end of the year to see who's over and who's under, and then make the transfers at that point. Am I saying that correctly, Janet?
Yeah, and we don't know yet if they're going to transfer, because they could transfer from the savings in our operating account to labor within our budget. So we don't know if they're going to do
We don't know
that,
if they're going to take
or
it
if they're going to
from
look at it
funds.
globally, throughout the county and all departments.
Because they knew that they were holding funds because the raises were going to cost more money. So, but they've been holding that separately. So we don't know if they're going to then put the money in from that account, or if they're going to want us to put it in from one of our accounts that actually is has a surplus. So that's not up to us. That's pretty much up to admin and finance over at the CAB building.
Any questions on the budget? None, now we move on to the elevator update. I think we might be able to take this off. I used it today, it worked pretty good.
The elevator is working, and I can tell you that, I can't tell you which day it was, but I can tell you that it was 15 months in one day to the moment that it was then operational and granted a certificate to be used. And then, even though it had a certificate to be used for a week, we were waiting for another part, but they said, oh, but you can use it anyway, and we'll just put that one on when it gets here. And I'm like, okay, it must not have been that important of a part, because otherwise we wouldn't have been using it. But it has been operational, not the entire month, but we're very happy that it's back and that the public can use the public elevator to get up and down, because we weren't sure how long the other elevator was going to hold out, because that one is from 1925.
That'll probably hold up another 100 years.
They said that one will outlive the new one,
Yeah, but it might outlive the new one.
Probably will.
so we can probably take that off. And we got it working now.
You can take it off. Pam asked me about it, and I said, oh, because last time this was on was a month ago, when we met in Neenah. And our report to you then was, we just got word as we were heading out of the building that it was working, and it was not. So
We go on a field trip to
here's
it?
our official go up and down.
All right,
You can take it up and down as many times as you want.
number 8, then Renee, your report.
So you heard us share with you last month, and I think even the month before, that we were working on implementing a mental health first aid training aimed at the workplace. So we had a national trainer named is Jennifer Cox come in with 2 days at the Best Western. We offered 6 sessions in person and via Zoom. And those that we tracked in person or on Zoom, we were 650 or so, but there were several departments, take Parkview, for example, that who was 200 and some employees. They were showing it there in their large training room. So they were keeping attendance there that would not have necessarily come back to us. My point is several facilities just did that for their employees. Like if we were to have done that here, we'd have had a bunch of people come in here, we just would have showed it on the big screen and several people would have gotten to attend without having to go over there. So I don't have those numbers, but Bill and I were projecting, we probably got 2/3 of the county. So certainly consider that a success. Yeah.
And I wouldn't say that we, I can't remember a time where we actually tried to do a training of all county employees at a kind of a one period of time before. And so this was an undertaking. We weren't sure how it was going to work. And we tried to make it accessible to people early in the morning, later in the evening. And we found out that most people wanted to do it between 7 and 5 or 6. So we ended up with kind of keeping that inside those boundaries. But, and we had a professional kind of broadcasting outfit that basically did the Zoom meeting. So that wasn't like set up a laptop and see how it goes. It was like they were following the person with camera. They were, panning to the PowerPoint when it was PowerPoint. So we tried to do it as professionally as possible. And so it's our first time we ever did it. I don't know that any of us want to do it again because logistically it was a nightmare. But it was important. And I think a lot of people, it was also important because many people had somebody really significant pass away in their lives this year in the county. And I think a lot of people were hurting still from that and got some ideas for themselves and also found out some techniques and some ways to identify in other people and then reach out and find out how they're doing as well. That was the idea.
We shared a lot of local resources as well during those sessions, but we also, since the training, have it on our intranet that just employees can access. Just pasted all those resources there. So they can be accessed anytime. We thought it was a success and well worth it. The other thing, not bullet pointed, so I won't create discussion, but given end of year, it's time for, if you have ideas for presenters for next year, think about that. Think about things you might want, like we had the health program today, other things you might want to hear about, because I'm going to be getting the list together for next year. You can email me if you think about it, let me know later.
These would be specifically under the umbrella of human services.
We try to make it related, of course.
This past year, we've had some provider agencies like United Way, Christine Ann, who am I forgetting?
The tiny homes, I forget her name, but they came over and gave us an
so we've had,
update about that.
this is kind of unusual for us because most of the time we just internally try to highlight for you once a month a certain part of human services and the work that they do. So that's more typical for us to do programs that way.
Yeah.
Than go outside.
And Kate, with you being on the full board, like for example, I was gonna have Trevor from Solutions Recovery. But most of you are on the full board, and so you were hearing those updates anyway about the neighborhood investment grant. That's just an example.
Yeah. Well, I specifically, I think about Damascus Road project.
We've had them here
Jeanette.
a couple years ago.
And they just were here. They were just here.
Oh, they were just
Yeah.
here, yeah.
Right.
Yeah.
She came.
This year?
Oh, yes,
Yeah.
she publicly spoke, she wasn't on the, because you were here that day, you were
Yes.
sitting over here. Yeah, but certainly, I mean, I don't know how long ago it was, did you say it was a few years ago? We can bring them back, we've done that too, we bring people back as the board members change.
Oh, she was here in the audience.
As the public
But
coming.
we've actually had them speak as a speaker
Mhm.
here.
Yeah, But yes, things like that, I can certainly jot that down if you'd like to hear from them again as a more full of a presentation. Sure.
Well, if you have any ideas, email them to
Yeah,
Renee.
just let me know. Thank you.
All right, Bill.
Okay, so my bullet points are review of the WCHSA, which stands for Wisconsin County Human Services Association, which we are members, all Wisconsin counties are members of the Human Services Association and have been for forever. Basically, it's an organization where county human services can figure out what we need to do to kind of promote human services programs with the State Department and kind of make that better. So we have what are called policy advisory committees. They are made up of usually managers who attend those committees and then interact with state people. We try to get on top of legislation that's coming out. We try to get on top of administrative law changes, administrative rule changes. We also meet with the secretaries quarterly, Department of Children and Families, Department of Health Services. We can meet with the Department of Corrections when we need to. It's an advocacy organization, and it is a subsidiary, or was at one time a subsidiary of WCA, which is the Wisconsin Counties Association, but it's now a separate association. But our lobbyist is shared by WCA and by WCHSA. And I happen to be president right now of the association. So we have a fall conference in December, which I always think is funny because the fall conference is always snowed when we have the fall conference, and we have our spring conference in May. So the next one is in May. It's in Wausau, and if you'd like to go to that one will include board members. Okay. All of you could participate if you wanted to go. It's a 3-day conference in Wausau. I'll give you more details when it's time to register for that. And this one was basically for directors and staff, and it was very well attended. We have over 100 participants, I think about 110. And first day, the schedule included having the Secretary of Department of Children and Families, Emily Allenson, speak about all kinds of different programming that they're doing at Children and Families. Most recently, though, she's become very interested in a federal grant or federal funding called TANF, which is Temporary Assistance to Needy Families. And she's discovered that Wisconsin isn't using some of its federal funding for children and families, and that she wants to figure out more ways to utilize that. So we may be embarking this year on trying to do some work groups about what other things can Wisconsin do to bring more federal money into Wisconsin to help families, children and families. And that could include childcare, because childcare is under the Department of Children and Families at the state, but is not part of our mission. So they're very interested in that. Then there was a discussion by Department of Health Services new secretary, Kirsten Johnson, and she just kind of gave an outline of all the programming they're doing. We had a state legislative update by WCA's Government Affairs Associate, Marcy Rainbolt, because our lobbyist, Chelsea Shanks, basically is off on maternity leave right now. So we got a Marcy update. She did really well with the kind of pending legislation. It's not an off time, it's off budget time for the legislature, but they are trying to accomplish getting some other legislation in before the end of this term, which ends in March. And then they switch, they go off in March, and then they're done until after the elections in the fall. And then they start up again after that. Okay, then there were some breakout sessions. One was on managing controversial topics with local elected officials, which I didn't attend, so I don't know what that's about. And you did the employee retention and recruitment and retention. You did not do that.
No.
I went to that.
Annette did.
Annette went to that one.
I went to the.
I didn't find that there were a whole lot of new ideas on recruitment and retention. Did you get any? What did you glean from it? Was there?
No, but just some reinforcing on that, like the things that we want to focus on, that purpose, like child welfare, purpose-driven job, how to support them in their self-care. That's how you keep them there. the training, just reinforcing, I thought.
And I thought one of the ideas I got from it was where we can give some time to employees if they had some special needs. And we pay attention to what those special needs are. Could we work with them around their schedule, around what's happening? Not that we can pay them more, not that we can necessarily let them off more, but could we work with them around, maybe they have a lot of needs for flexing their schedule for a particular thing that's going on in their family. And we've historically done that. We've allowed flexibility in their scheduling and adjusted work schedules and things like that. So it was kind of reinforcing that was an important piece on retention. But not all counties give a lot of flexibility on that. And we try to as much as we can. Okay, and then there were two other breakouts. One was called Developing New Human Services Leaders. I was a panelist on that one. Basically, I can tell you that we are not really far along as a county on developing a leadership training program for emerging county staff leaders. And we do it informally. You know, we try to mentor people informally. We try to give them informal kinds of opportunities to learn some leadership skills. But we don't have an official leadership training program in our county. And there's other counties that actually have implemented leadership training for their staff. Now, you know, the county exec will tell you, well, there's been a couple of slots opened at NACO for the Leadership Academy, which is true. It's a very expensive, pricey program. Renee's went through it. A lot of good information, but it's how much? A couple thousand.
Persons, yeah.
A couple thousand per person to engage in that. So it's
3 months long.
It's very expensive. But other counties have come up with kind of leadership development inside their county. Some using the extension, some that have kind of come up with some local leadership trainers. But we really we don't have a formal one. I had to say as a panelist that I'm representing a county that doesn't really have a formal leadership training program. I felt a little silly being up there because all the other panelists had these kind of robust training programs. But I said, you know what? If you're not there, like we're not there, you know, don't feel bad. As long as you're, you know, thinking about ways to develop a leadership program. That's what's most important.
Like Billy, you were there because you're the WICSA president, the leader.
Mm-hmm.
They rationalize it that way.
Yeah, I rationalized it any way I could in the moment because I'm like, I don't have a leadership program to tell them about.
I would also say it was very helpful for 90% of the people who were there who didn't have anything to hear from somebody that they didn't have anything, and that it's okay that they're gonna work on informal things, because you talked about all the informal things that we do. It just isn't this formal program. So
It's not formal, but I think we all think of ways to develop our staff.
Yes.
You know, so it's not like we're not doing any leadership training. It's we're not doing anything. We don't have any formal way of recognizing, hey, this is a bunch of upcoming leaders. What kind of like formal training do we want them to engage in? And we don't have that. So
I would recommend though that Winnebago County look into that for staff members. As 36 years in Winnebago County management, I felt a void there.
Yeah.
That would have been nice to have. I went through leadership Oshkosh and all that, but that wasn't that much. That was more social and chamber related. But I think it'd be good for staff, you know, to go through that.
Well, I think it is something that's a challenge for us to think about. How can we?
I would recommend
develop a leadership training program.
You guys look into it, yeah.
And the last one was managing communication and media. That was the one that you introduced the speakers for that one.
Yeah, yeah. When you do breakouts at the same time, obviously one is in competition because people choose. I go to this one or I go that one. So the majority of the folks in attendance that day were at the other one. So we only had about 10 people, which was really too bad only in the sense of we had Claire Paprocki. She's a communication specialist from the Public Health Department in Brown. They are Health and Human Services, but she's in the Health Department, and she started in that position in January of 2020. So right when the pandemic hit, you know, of all times to be in public health as their communication specialist. So she shared some good insights about, you know, because she'd been interviewed and quoted, you know, several times, misquoted several times. So she was using that experience to say, here's some things that worked really well, here's some things that I've definitely learned along the way, to do differently. I took a whole page worth of notes. Her main message was, get to know the media people in your county. Like sometimes, as you know, we have folks here from the Herald or, or they're listening and or whatever. And she's like, try to have it be a proactive, build a trusting relationship like you do with any other partner or colleague, and really get ahead of what you want your message to be. So anyway, it was helpful.
Yep. And then day 2 was, we had all of our policy advisory committee chairs give our 2023 accomplishments and our 2024 goals. And I can tell you, there's just a whole bunch of things we're going to be working on in 24. And our main goal is basically to get good communication with the departments and with the legislators, so that when we come in and we have an ask, that we can actually get them to put it in the next biennial budget, because the next one's coming up in 25, which seems like a long way away. But actually, by the middle of next summer, the departments are actually formulating their requests for the 2025 budget. So what they told us was, we have to have our act together as counties by May of 24, with all of our asks ready to go, so that we can potentially get it into the governor's budget for 25, and then start working on the legislators. Because we wait too long. What we found out is that we don't really get our asks together until later in 24, and that's too late. We got to get it together by May, and then really start the campaign of what do we want to see the changes be, and really get to our legislators in the fall of 24. Because we wait till April of 25 before we let people to our human services day, and by that point it's too late. So they give us some good advice. And then the last thing was, we actually had 2 legislators, Representative Donna Rosar from Wood County and Representative Pat Snyder from, I think he's up in Wausau area. And they came and talked about what would be helpful with our relationship with our legislators. And they gave us some good advice. Again, start early, speak to them often, develop those personal relationships with the legislators, because if they don't know you, they probably aren't going to care about what you have to say. So you can't be a stranger and then come in and want a bunch of stuff. You have to get to know them, and I thought that was good advice, and we've taken that to heart here. We got to know Representative Schra really well. Gordon Hintz, when he was a representative, I think we worked with him quite closely. Who are the other legislators right now? Lori Palmieri is a representative. Snodgrass.
Cuffiston.
Yeah, Nick. Well, Nick, you guys know him quite well. He's a fellow county board supervisor. And then we have Senator Fine.
Rachel.
And Rachel, that
Yes.
long hyphenated last name that I always can't remember. So yeah, so we got to develop those relationships, and we got to advocate. So that's what we're going to do next year. So that was the report on the fall conference, which was longer than I expected it was going to take. Next one was review the state legislative bills pertaining to human services, which are 2 primary ones that I wanted to mention today. One is they're going to expand the definition of like kin. They want to expand it from just kin for kinship care to like kin. And the big definition change would be people who are known by a child but aren't necessarily a blood relative.
A godparent maybe, or something.
So someone that was, let's say you're in a neighborhood, and let's say your kids spend a lot of time with a certain neighborhood family, and then they need to go somewhere, and they say, well, what about my neighbor? What about my neighbor who we know who they are, the kids spend time together, we could still see them, what about them? Well, under our current definition, it doesn't work. So having that like kin expanded would be helpful. Plus it goes to lesser levels of cousins and things that get expanded too, which would then give us some more possibilities. So we're very much in favor of that. And then another one that's going to greatly benefit us is in the children's long-term support area. Basically, for that to be expanded, counties had to give a certain amount of what's called maintenance of effort. Well, how maintenance of effort was devised was in 2016, any county who put levy into their children in long-term support area has to maintain that same level of support from levy going forward. And so for us, we were the second or third highest contributors of levy because we wanted to get kids off the waiting list. Other counties didn't do anything. So what happened is that because this got frozen, some counties are frozen with zero from now until whenever. And other counties like ours are frozen at about 800,000-ish dollars. That was levy. That was our own county levy. And so what Representative Schraw is authoring is a bill, and I'll let you know when it's out. Hasn't gotten out yet for circulation, but authored a bill that basically says, as of 2025, no counties will have to provide any of that maintenance of effort, and that they will have to come up with where they're going to get the total $6 million from other than there. But because it's such a disparity from one county to another, and not based on size, not based on any criteria, just based on how much money you decided to throw into the kitty in 2016. So we're really excited about that bill, because if we can free up $800,000 from that pot to be used more universally for where our needs are, we're going to be in a much better place. So that one's coming. I'm excited about that one. There's a few other bills, and I don't want to take time to mention those right now. Plans for housing new staff in Oshkosh and Neenah. So we did get 30 new positions, a total of 27 FTEs. And of course, then it wasn't that we just thought about where we're going to place them after we got the positions, but we have to make some changes in terms of where staff are located in order to accommodate all of that new staffing, some of which are already here, but others are going to be additional. And a big change is going to be the children's long-term support managers up in, or case managers up in Neenah are going to be in a separate rented building, which will be down right across from Theta Clark Hospital. So they won't be in our office, but they'll literally be no more than 2 city blocks down. I don't think it's even one city block down from our Neenah office. So even if, and most of the time, those folks go to families, so families aren't going to them. So, but even if they needed to meet in the office, it's only a block difference between our Neenah office and that office. So I think that was a good find for us in terms of that rental space. And then also in the mental health area, the CCS program, or no, the alcohol and other drug abuse or substance abuse programming, we're going to move the remainder of our staff here in Oshkosh will all go over to the basement of Warren King, which again isn't that far, it's a couple blocks. And then that'll free up some additional space here for some of Heather's new staff. So that's going to be a change. Then we're doing some rearranging of offices up in Neenah, which I don't want to get into because I don't even know where we landed. But just know that we will have a home for everybody who we've added. And even the additional space that we're renting basically is covered by Medicaid. Right? So the county's not paying for the additional space. Okay, and then last but not least, just want to remind you about the holiday luncheon, which is day after tomorrow.
Yeah.
And it is out at Expo Center. It starts at 11 a.m. and it goes until no later than 1. And it is our holiday staffing, staff recognition, smorgasbord lunch, games and prizes that'll all be contained in that 2-hour block of time. And all of you are welcome to attend if you want to attend. If you let us know that you're planning on attending, so we know how many people are coming. If you do come, you don't have to speak, but I will have a section in there where I'll say any board members here who want to, say a couple of words to the staff, you can come up to the microphone and then just, usually people are just saying some words of thank you or whatever you'd like to say to the staff in honor of the occasion.
I encourage everybody to bring a couple of good pens so you can sign holiday cards to Parkview.
Yeah, and we're gonna, while you're waiting for the smorgasbord lunch, there's gonna be cards on the table for Parkview residents that you can sign Christmas cards for them. Because they do like getting Christmas cards from staff.
And I also have an ask this year, hoping that you guys would be okay with it. We'd like to include the board member table in with the staff tables when we're inviting them up to eat. You know, you guys are our distinguished guests, you're our board members, but this event is truly to recognize our staff. So we'd like to, when we're doing that, to allow them, some of them to go first, and that it would just be a random thing.
So then we go last.
So our table isn't necessarily
We go
gonna go
last,
first,
right?
like in
That's
years
Where you
past.
was, where to sit.
You guys sit wherever you choose to sit. Usually Bill grabs you a table and you sit. What happens is
Okay.
on each table, there's gonna be, and we do this all the time. There's like a flyer on there that for you guys, you know, they will have to do with the movie. So I will say, I don't even know, Rudolph the Red-Nosed Reindeer, and whoever has Rudolph on their table, that's who goes first.
Okay.
And so what I'm saying is we would include you guys in that this year versus saying, board members, go ahead and go first. And that's only, I mean, you guys
Sounds
hear us
fine.
talk a lot about, you know, taking care of the staff and that this is recognition for them. So I'd like to make that shift if you guys are accepting of that.
Good idea.
For those of you, we did it last year. For those of you who were there, remember, we just, and that just called.
Bill, don't forget your tie.
Just called.
I
Yeah, so
do have my
who-
time.
So Karen, you're coming,
Mhm.
Mark, who else? Anyone else coming?
I can come now.
Okay, good.
I'm coming as well.
All right, great,
Okay.
Becky.
Great.
Isn't it also ugly sweater contest?
And I don't know if we're having a contest, but it is wear your ugly sweater. Yeah.
If you don't have to wear an ugly sweater,
I don't remember that.
Nobody did say it. This
It was
Oh,
on
I did
there.
say it, but geez, I'm on the committee. I should.
I think we find
Then
it
you
for
didn't have to read it because you knew.
And then it's on the invitation.
Where's?
Too busy taking care of all the details. Yeah.
I'll just wear my sweater and I'll
Yeah,
say
this
it's
is-
a.
I gotta.
All a matter of perspective.
Yeah, it's all a matter of perspective.
I don't like
So if
this.
you haven't been there, you will be well fed. There will be plenty of food. I think we always have leftovers,
Oh, yeah.
so, it's a very nice time, and I can tell you, as long as I've been here, the staff appreciate every single word that you might say to them. They remember it. They appreciate the fact that you're there, you know, that you're recognizing them as well. And that you're part of this. So, you know, it's very meaningful. And I think it's a good way for you to see probably anywhere from a half to 2/3 of our department might show up.
So even though not everybody is there are a lot of people there. You realize how big this department is.
Yeah, you get a sense of how big the department is by just how many people are there. And that's usually a half to no more than 2/3 that are there, so. All right, that's it.
Any questions on those 5 bullets? Seeing none, then board member reports. Kate, you got a report? Anything you wanna report to the board?
You don't have to.
You don't have to.
Oh, good.
What do you-
Phew, I'm sitting there. What am I supposed to say?
No, it's if you went somewhere
If you
and
went
you want to
somewhere, you did
report where you
something.
went, what you did, and some activity around human services, you could do that. Or if you, the problem is you can't pose a question now because we can't engage in a question and answer about things, but you can say, I'm interested in knowing about something. I mean, you can kind of ask something that we could maybe work on and present to you next time. But it's reports like they're on county board, like what would you report
What
about?
what did you
Kind of follow
attend?
this out. You don't have to.
Ralph?
Good, thank you.
Let's see now. No,
Nothing.
I'm always looking for volunteers for Celebration of Lights. It's a great time if you ever want to do it. A group gets together in the huts, 3 or 4 people. It's a great time. Last night, I think I was there, we had just about 900 cars lined up all the way to South Park. The night before was 940. We're 2,500 cars ahead of last year in the park here, so it's a great community thing, but you get to see a lot of people that are out. And groups come to us a lot of times. Pantry was just 2 truckloads they took out yesterday.
I'm gonna take a group tonight.
So I mean,
Community night,
it's
so
worth
gonna be
coming.
packed.
It's a great event and it's all new. So it's a.
Oh, really?
Oh, yeah.
Yeah, it's all the EA now.
Yeah, we created all the ones that we didn't have in the past, fixed them up. And then It's a whole different route. It's never been there before.
But expect at least a hour and a half long wait in line. That's-
And this is it?
At EA.
Yeah.
Last night it was, I
It's
think,
basically a drive-through, right?
right, it's a drive-through.
But it's a lot more, because they can put more of their stuff up, because in Menominee, you're kind of limited
Right.
on what you.
But
can
it's
put up.
kind of neat if a lot of people, EAA comes, they leave.
Yeah.
So you get a chance to see EAA from the front of it all. And which is cool this year is that Santa is in the lodge at the end. And if you remember the bridge, we used to have the bridge where they had the light. Now it's a walkway to Santa. But it's a big lodge that most
like the
people
snow
say they
time
never
at
even knew was
Saturday.
there. There's 14 or 15 executives stay there during EA. So you get to see things around EA that you never saw before if you never were an airplane person, so. So there's a lot of different stuff, so it's worth coming, that's it.
Yeah, we got it. Chris?
Oh, I'm sorry. Thanks for all you do. Sorry I can't make it Wednesday.
Harold?
Stitching those
No, this
beautiful.
one, I have no report.
Art?
Fingers.
Uh-huh.
Keep doing it.
All right. I don't have anything.
Can I put a shameless
I'm sorry, I
plug
forgot
in?
about you. Yes.
That's
Go
okay.
ahead.
Can I put a shameless plug in for an event coming to downtown Oshkosh on the 15th and 16th?
Yes.
It's there'll be a performance of the Nutcracker Ballet by Valley Academy of the Arts at the Grand on the 15th and 16th. There's 3 performances. My daughter and husband are actually in the show.
Good.
Wow. Your husband does ballet?
Yes, it's his first time. It's his first time.
Oh, boy.
Well, thank you for that, yeah.
You're welcome.
What time is it, Peggy?
What time is it, Ava? I think it's 7 p.m. on Friday and noon and 7 on Saturday, the 16th.
All right, thank
And you can get tickets through the Grand.
Wow.
Can we ask her what she's cooking? She's got to eat her.
What
Are
are
you
you
cooking?
Oh, no, there's no cooking. No. Oh, what am I cooking? I was making soup while
Alright,
listening
thank
to
you.
while participating in the meeting.
Okay.
All right.
So, seeing nothing else, I entertain a motion to adjourn.
So moved.
Second.
Make a second, all those in favor say aye.
Aye.
All those
Aye.
opposed? All right, we're adjourned, thank you.
All right, we'll see you in the new year.
Really, copy here?